Sudden knee pain, causes and symptoms. The complexity of the knee joint allows it to support a wide range of movements, but it also makes the area vulnerable to a variety of injuries and chronic conditions. Each year in the United States, about 12 million people see doctors for knee pain. Researchers found that among all people seeking medical treatment in the United States country between 2007 and 2011, 1.5 to 7.3% sought care for pain in the front of the knee alone. We describe common causes of sudden knee pain and the symptoms that tend to accompany it. We also look into the options for diagnosis and prevention. Causes of sudden knee pain. Some of the more common causes of sudden knee pain are anterior cruciate ligament or ACL injuries. This often occur during sports that involve jumping or other sudden changes in direction. They can cause instability or prevent the knee from bearing weight. Posterior cruciate ligament or PCL injuries. This can develop after a blow to the front of the knee. Collateral ligament injuries. These contact injuries often happen during sports. Meniscus tears, tackles, twisting, aging and arthritis can each damage the knee's meniscus, its shocking absorbing cartilage. A person may feel the knee locking or experience discomfort going down the stairs. Fractures. The three bones of the knee joint can fracture or break. The patella or kneecap does so most frequently. Patellofemoral pain syndrome, sometimes called runner's or jumper's knee. This mainly causes pain at the front of the knee that gets worse with climbing the stairs, squatting or bending. It sometimes causes popping sounds or swelling. Dislocation. This can occur when the thigh bone, shin bone and patella are out of alignment due to structural problems or injuries. Tendinitis. This issue, inflammation of the tendons around the joint, stems from overuse and is more common among middle-aged athletes. Bursitis. Repetitive motions like running can cause sacs of fluid around the knee to become irritated, painful and swollen. Osgood-Schlatter disease. This overuse injury is most common in teenage boys, particularly in athletes. The symptoms include soreness around the knee and pain when extending the leg. Arthritis. This develops when the cartilage protecting the joints breaks down and leaves the bones rubbing against each other. It can cause swelling, stiffness and a reduced range of movement. Sometimes physicians cannot identify what is causing knee pain. For about 30% of teenagers who seek treatment for pain at the front of the knee, a doctor cannot diagnose the cause. Accompanying symptoms. We describe specific symptoms of issues that commonly cause sudden knee pain, but in general, one or more of the following tend to accompany this pain: swelling, stiffness, a clicking sound with the pain, pain when rising after sitting, pain climbing the stairs, pain descending the stairs, the knee locking or not bending, the knee giving way. The exact location of the pain can help identify the cause and the best way to treat it. For example, pain between the kneecap and the shin can be a sign of repetitive use injury, such as from running. Diagnosis and testing. Unless sudden knee pain clearly results from an injury or accident, or the pain is severe, most people can safely wait for a few days before seeing a doctor. During this time, people should avoid or limit any activities that cause discomfort. Resting, applying ice packs, and using non-steroidal anti-inflammatory drugs such as ibuprofen can provide relief. Symptoms may then start improving. However, this does not always happen. A visit to a physician typically begins with a complete medical history and an overview of the person's activity level. The doctor then manipulates the person's leg, checking for pain, tenderness, and swelling. They also do this to assess the range of motion. To make a diagnosis, a doctor may need imaging such as MRI scans or X-rays. Home remedies. One of the most important treatments for knee pain, physical therapy, is not strictly a home remedy, as a trained physical therapist prescribes certain movements and exercises, but people typically do this at home. In order to see benefits, a person must commit to a regular physical therapy routine, which often requires daily or twice daily sessions. People can do these exercises on their own. Although it takes time to see improvements, the results are often long-lasting. Braces and bandages can immobilize injured parts of the knee and provide support. The aim is to help minimize pain and prevent further damage. Manufacturers market a number of supplements for knee pain, such as glucosamine and various herbal compounds. However, little scientific evidence supports their use. Prevention. Wear and tear on the body is inevitable, and injuries can be hard to avoid entirely. Still, the following can help people can maintain or improve their balance, strength, and flexibility, offering some protection from sudden knee pain. Strengthening the core and hips, maintaining flexibility in the joints, improving alignment, increasing levels of activity slowly, wearing shoes that fit well, stretching regularly.